the number one way to potentially save tens of thousands of dollars when it comes to your health care and long-term care after you turn 65. Hi, I'm Chris Brining, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. My goal is really simple. It is to help you make a wise and competent decision about all of your Medicare choices. If you need my help enrolling in a plan, then please reach out to me. You will see the contact information at the end. If today is your birthday, then happy birthday to you. Herbert Asquith said, youth would be an ideal state if it came a little later in life. First, let's talk about healthcare costs. Did you know that the average healthcare cost for a post-65 Medicare beneficiary is over $10,000 per year, or over $200,000 for the rest of their lifetime? According to registered nursing, by the time you reach 65 years old, average healthcare costs are $11,300 per person per year in the United States. And during one's lifetime, over $400,000 will be spent on the average American's healthcare in today's dollars. HealthView Services states total lifetime healthcare costs for a healthy 65-year-old couple retiring this year are projected to be at $387,644 in today's dollars, or $572,960 in future dollars. This includes premiums for Medicare Parts B and D, supplemental insurance and dental insurance, as well as out-of-pocket costs related to hospitalization, doctor visits, tests, prescription drugs, hearing services, hearing aids, vision, and dental. RBC Wealth Management states the projected lifetime cost of care for a healthy 65-year-old is $404,253, and that does not factor in long-term care costs, which could be as high as $100,000 per year. So when it comes to these healthcare costs, as RBC has mentioned, it doesn't include long-term care costs. So you get into long-term care, that's in-home care, assisted living, or nursing home care. Now we're running not just $10,000 a year, we're running potentially $5,000 to $10,000 a month for that. If you're worried about that, then we need to talk about long-term care insurance, but that's at another time. So why are healthcare costs so high? Well, first of all, we have a very inefficient healthcare system, and then there are chronic health conditions, of which many can be avoided. If we look at illnesses, we have cancer, where 40% of people develop cancer. We have heart disease, where 50% of people end up with some form of heart disease. Then we have diabetes, with up to 33% of people having type 2 diabetes. Plus you have COPD, neurological issues like Alzheimer's and dementia, Parkinson's disease. U.S. Pharmacist website states, according to the Federal Interagency Forum on Aging-related statistics, 35.8% of persons aged 85 years and older have moderate or severe memory impairment. So how can you potentially save tens of thousands of dollars on your health care and long-term care costs in the future? Why, as an insurance agent, am I even discussing this? Because I have seen too many times, too many people that have too many health issues because they either eat too much of the wrong foods, drink too much of the wrong drinks like alcohol and soda, they smoke too much, sit too much, and they watch too much garbage on the TV and the internet. Now, you may think that I'm meddling with you or some other people, but it is a passion that I have, and it is a concern for people, knowing that if we just altered our lifestyles a little bit, we could be much happier and much healthier. So here's my disclaimer. Obviously, I'm not a doctor. I'm an insurance agent. I'm not giving you specific medical or healthcare advice. I'm just reminding you of what you already probably know. So how can you save money? First, desire and develop a healthy lifestyle. It all comes down to three things: your diet, your lifestyle and exercise, and your attitude. Let's talk about diet. Your diet can either cause a disease or will avoid and potentially cure a disease. Consider seeing a good health doctor or nutritionist. Avoid too much sugar. We all know that. High fructose corn syrup. We should all know that. Processed food, bad drinks, too much alcohol, and too many sodas. Instead, replace with good water, good fruits and vegetables, good fats like avocados, nuts, coconut oil, good meat, pastured, grass-fed, the best you can get. And also consider try intermittent fasting or a ketogenic diet. Of course, talk to your doctor before you do any of this. Next, we have lifestyle and exercise. If you smoke, please seek help and quit. Start moving, start slow, walk more, sit less. Consider HIIT exercises, high intensity interval training, and or body weight exercise. You can do body weight exercises right at home. You don't need to go to a gym. You can start out very slow by doing some push-ups or pull-ups or squats or sit-ups anything. Do everything you can to be as healthy, fit, and strong as you can. And then it comes down to your attitude. Avoid negative situations, things, and people. News, videos, books, people, and places. Instead, think positive, read and listen to good books, podcasts, and music, pray and or meditate. Yes, you can live a very healthy lifestyle and you could die tomorrow. If you all remember the guy, the runner Jim Fixx, that wrote the book on running and ended up dying from a heart attack. And yes, you could live an unhealthy lifestyle and live till you're 100 years old, but that is not the norm. So why should you do this? You'll probably feel and think a lot better and stronger. You'll limit visits to the doctor and the hospital, which will reduce your co-payments and your costs. You may avoid a very costly and deadly disease. You'll be able to experience more of what life offers, hobbies, friends, family, and vacations. You'll save money and time. It will bless and help your family, your spouse, and your children. If you're getting older and you get in better shape, then you may not be as much of a burden on your adult children. I hear that many times. I don't want to be a burden on my adult children. Well, adult children do have a responsibility of taking care of their aging and elderly parents. I did that for many years with my mom who had Alzheimer's. She lived in our home. We took care of her for many years. It was a responsibility that I had. But there are things that you can do to not be as much of a burden. The better in shape you are, the longer that you will live, the less likely you'll have medical issues or need full-time nursing care. If you need some encouragement, I will put some links in the video below. These are some people that I like to watch and listen to. Dr. Berg, Dr. Greger with Nutrition Facts, Dr. McCullough, the YouTube channel Health and Longevity, David Sinclair, and Andrew Huberman. So if you have questions and you need help when it comes to your Medicare, please reach out to me. You can go to my website, see lots of information on there. There's also some contact pages that you can connect with me if you want to schedule a time to talk and review your Medicare options. States that I'm currently licensed in: Virginia, North Carolina, South Carolina, Florida, and Tennessee. And if you happen to live within an hour or so of the Charlottesville, Virginia area, and you would like to meet in person, then please reach out to me and we can figure out when to do that at a safe and convenient location for you. I want to remind you to please like, subscribe, and share this video. And if you don't mind, put in the comment section below what state that you are watching from. I hope I didn't meddle too much, but that is the #1 way that you can save tens of thousands of dollars on your healthcare and long-term care costs in the future. It is by living a healthy lifestyle from here on out. I hope that's helpful. I hope you give it a try. I'm Chris Brining, the Medicare analyst. Make it a great and healthy